Good afternoon. I hope you are fresh from wherever you are. We are continuing with our education on ulcers. The last time I was giving an overview about peptic ulcer disease, which is a very common disease worldwide. Today I want to discuss a few things more. One is to quell the myths. Then two, why you need to respond to it, to treat it quickly. And then the kind of tests that your doctor may need to do. And a brief about the nature of treatment that you need for ulcers. So many times people believe that their ulcers is because of stress. Some believe their ulcers is because of drinking alcohol, others because of smoking. But as I said in the previous video, the commonest causes of ulcers is because of a bacterial infection, which is responsible for more than 90% of the peptic ulcer disease cases. And then the long-term use of certain kind of painkillers, which are used in an inappropriate manner. These other ones, they are myths. They only worsen ulcer symptoms when the ulcer was already existing. So stress is not the cause of your ulcers. Alcohol did not cause it. Smoking as well did not cause the ulcers. But please, do not have your stress treated. Consult a doctor for it. Excessive drinking of alcohol is harmful to your health. Excessive smoking as well is harmful to your health. And even with ulcers, if you already had it when the symptoms were still mild, these things will worsen the symptoms of your ulcers. So avoid them still. The other thing which will worsen the symptoms of ulcers but will not cause it, I think drinks like coffee, drinks with the caffeine, those ones can also worsen the state of your ulcers. Why do you need doctor's attention for your ulcers? It is because it can be complicated. As we said before, it can reach a level where the wounds in the stomach and the duodenum are bleeding. So you can have a complication of a bleeding ulcers. This can lead to severe blood loss. That can lead to death. The wounds can also become very severe that they can cause perforation of the stomach and the intestines, in which case the stomach contents will be leaking into the abdominal cavity. Those are usually medical emergencies and life-threatening situations. The commonest is the bleeding. Many people with ulcers, by the time they are presenting, they present when they are already bleeding. You may not necessarily be vomiting blood, but you are bleeding and blood is going together with your stool as you go to the toilet. So ulcers needs to be attended to, because if not, it can lead to life-threatening conditions. Okay, what do you need done? One, you need to see a doctor. You need to see a doctor to attend to you. And what he will need to do, he will need to screen for the infection, for the H. pylori infection. The best test is preferably the stool test, which tests the H. pylori antigen. to be able to ascertain whether there is still an active H. pylori infection or not. And then we may need to do checkups for you, since we said the bleeding can be a result. We may need to check your blood level. We may need to do your Cthulhu analysis to check if there are any other things in stool. We may need to do occult blood in stool to check if your ulcers is causing you bleeding. We may need to ascertain that. So your doctor may need to request for those tests, and when he asks you for that, you know that is the reason why. This is the main cause of ulcers, and that is what can be important. Now, many people usually think that whenever they have abdominal pain, they need a scan to be done. In ulcer case, the scan cannot diagnose ulcers, because this, we said, is a wound in the inside lining of the stomach and the duodenum. The scan will only see the solid organs of the abdomen, and may not be diagnostic for peptic ulcers, but it can help us in case the doctor is suspecting other causes of the abdominal pain, to rule out other possible causes of the abdominal pain, the differential diagnosis. I want to talk briefly about the treatment care. Many of the people with ulcers are not on the rightful medications. People are taking omeprazole from January to December, and they are not taking any other medications. Ulcers, after assessment, when we have known that there is H. pylori infection involved, we usually need the good antibiotics to eradicate the H. pylori bacteria. We give the omeprazole, which is a proton pump inhibitor, and other antacids to reduce the level of stomach acid. Why we do that is because the stomach acid, which is normally secreted in the stomach, once it spills into the ulcer site, it causes the ulcer symptoms of pain and the burning sensation that the patients usually get. So in its treatment, we need to counter the stomach acid, which we can do by using antacids like magnesium. It can be things like the Relsa gel that you usually get from the pharmacies. It can be proton pump inhibitors that we commonly use, like omeprazole, lansoprazole, esomeprazole. We need that to counter the stomach acid. And then we need antibiotics, which needs to be taken for the right course. Usually we do what we call triple therapy, which is treatment with 3 different combination of drugs: the antacid or the proton pump inhibitor, which is 1, and then the 2 different antibiotics that we use to be able to eradicate the bacteria. This treatment usually goes for a course of 2 weeks, but remember, the ulcer wound may not completely heal in the course of 2 weeks, so we may need to keep you on treatment for 3 months with the antacids and the proton pump inhibitors to help give ample time for the ulcer healing to take place. In a case the ulcers have stayed for very long, we may need to do other tests other than the ones that we discussed above. You may need a scope. You may need an endoscopy to be done. Endoscopy is when we may need to enter a camera into your stomach. That camera will help us to identify exactly where the wounds are, the nature of the wounds. It will also help us to rule out other potential causes of symptoms like ulcers, especially when the ulcers has been long-standing. We need to rule out the possibility of the ulcers being complicated with it changing into stomach cancer, Please, I did not mention earlier that stomach cancer is one of the complications, but when your ulcer is not treated properly and the wounds take long in the stomach, it has chances of creating a stomach cancer. And this is why you don't need to just treat ulcers and ulcers for very many years without you going for an endoscopy. Because you may be thinking you're treating ulcers when it is already a stomach cancer. So please, ulcer wounds, when it takes very long, it can actually become a cancer in the stomach. And most of these patients actually die because of gastric cancers as a result of ulcers which has been there for very long and has not been taken good care of. The other reason that why we need the endoscopy is that at the severe stages of ulcers, we may need the surgical intervention. There may be need for surgical treatment. We may need to do band ligation with the help of endoscopy. We may need to do a surgery on the ulcer wound from inside the stomach using cameras. That would be the last stage of treating your ulcers. So the ulcer has not failed to be treated. Probably you have not followed the right course of treating your ulcers. For any questions, you can put the comments below. I'll be able to respond to some of your questions. Thank you very much. God bless.